Hello, everyone, and welcome to this webinar highlighting one of the many behavioral health treatment program models we have here in Virginia. My name is Nelson Smith. I'm the Commissioner of the Virginia Department of Behavioral Health and Developmental Services. And first, I want to say thank you to the Virginia Hospital and Healthcare Association for hosting this event and inviting me. In a few moments, you're going to learn more about a new pediatric behavioral health program at the Children's Hospital of King's Daughters during this webinar presentation. But before we get started, I'd like to take this opportunity to briefly highlight our vision and direction here at this agency and our shared mission to strengthen the Virginia behavioral health system in order to serve Virginia's patients, families, and those who access treatment services. Our system has a lot of stakeholders to include this agency, community service boards, hospitals, patients' families, advocates, law enforcement, and many others. The roles of these stakeholders differ, but each one of them is a direct, important part of making this system better. Enhancing our systems is going to require innovation and investments from the public and private sector, and continued collaboration and dialogue to identify the opportunities for improvement, developing effective strategies, and then we're going to execute on those. Here at DBHDS, we have a very, very broad mission that affects hundreds of thousands of individuals with behavioral health disorders and developmental disabilities and their families in every corner of this Commonwealth. We are committed to ensuring that they have consistent access to quality care no matter where they live. To do this, we're going to focus on three things: strengthening our workforce, expanding the continuum of care, and modernizing our systems and processes. In doing this, it's going to have a tremendous impact on the delivery of quality services from inpatient to outpatient and from early intervention to intensive services for people seeking mental health, substance use disorders, or developmental disability services. We're going to be working to ensure that we have the staff to do it and ensuring we are making it easy and accessible or to bring new business here to Virginia, in part by supporting strategically developed supported services in the private sector. The work that we're going to do will guide much needed improvement and help transform our system so that Virginians can thrive in their communities. So I want to thank you for your partnership, your interest, and your commitment to being part of the solution to enhancing Virginia's behavioral health care system. And now, as they say, on with the show.
Good afternoon, everyone, and thank you so much for joining us for today's webinar. My name is Jennifer Wicker, and I serve as the Senior Director of Policy and Government Affairs for the Virginia Hospital and Healthcare Association. A special thank you to Commissioner Smith for his introduction and ongoing partnership between DBHTS and behavioral health stakeholders. As we highlighted during our previous webinars in this series, there are so many individuals and organizations who share a passion for improving access to behavioral health care and treatment for patients and families in need across the Commonwealth. It is our hope that this webinar series helps to underscore the importance of partnerships and collaboration, as well as open communication between stakeholders to solve system-wide challenges. As we all know, no one part of the system can effectively impact change alone. As a reminder, during this webinar series, we will spotlight successful, innovative hospital programs that have received some funding from DBHDS and the state. Joining us for today's installment are Stephanie Osler, Director of Mental Health Outpatient and Community-Based Programs at Children's Hospital of the King's Daughters, or CHKD, and Michelle Peterson, Executive Director of the Sarah Michelle Peterson Foundation, a suicide prevention organization based in Hampton Roads. Over the next 30 minutes, we'll discuss the new Children's Pavilion at CHKD, the rising demand for child and adolescent behavioral health services, and more. Welcome to you both.
Thank you.
Thank you, Jennifer.
We have a lot to unwrap this morning, but to begin, let's talk about child and adolescent behavioral health care in the context of a system that primarily focuses more on adult services. Often when people think about behavioral health, their thoughts focus on the adult population, but there is a rising prevalence of youth behavioral health challenges. Data from the Centers for Disease Control and Prevention indicates that 15% of adolescents ages 12 to 17 had a major depressive episode in the past year. Nearly 37% had persistent feelings of sadness and hopelessness. Almost 19% seriously considered suicide, and 4% have a substance use disorder. And when it comes to youth access to treatment services, Mental Health America notes that even in the states with the greatest access for youth, 1 in 3 are still not receiving the mental health services they need. Those numbers are alarming. However, there is some encouraging news on the horizon in Virginia. There is general consensus amongst policymakers in Virginia on the need to make significant new investments in behavioral health access and workforce development. But gaps in the system and staffing challenges remain a concern. As you look at the system, Stephanie, can you offer your perspective on the trends you've observed and how demand for care has shifted over time?
Absolutely, Jennifer. Thanks so much for the opportunity to be here today and to speak with folks about this. First and foremost, I've been here at CHKD for the past 19 years. And when I started my work here, I actually was a clinician working in the emergency department. And in that period of time, 2003 to 2014, when I was doing my work in the emergency department, it was common for us to see a handful of kids in mental health crisis each week. So maybe 4 or 5 a week. Today, as we continue to do our work in the emergency department, we are seeing 15, 16 to 25 kids every day. Before I came on this webinar today, I looked at our census. We currently have 14 children in our emergency department that are in mental health crisis. So as alarming as pre-pandemic child mental health problems were, the pandemic has certainly exacerbated this crisis. A recent analysis revealed that 1 in 4 youth are experiencing depression and 1 in 4 have anxiety as well. Additionally, rates of suicidal symptoms, including suicide attempts, have risen since the start of the pandemic. The exacerbation of racial disparities during the pandemic means that children of color are disproportionately carrying excessive burdens of risk. In this context, national child experts, including the Children's Hospital Association and the American Academy of Child and Adolescent Psychiatry, declared a national state of emergency in child mental health in 2021. And the Surgeon General highlighted the crisis in a recent advisory. Since the pandemic began, rates of psychological distress among young people, including the symptoms of anxiety and depression, which I spoke of earlier, and other mental health disorders have increased. Recent research covering about 80,000 youth globally found that depressive and anxiety symptoms had doubled during the pandemic. So again, about 1 in 4 for depression, 1 in 4, 1 in 5 for anxiety. Early clinical data are also very concerning. In early 2021, emergency department visits in the United States for suspected suicide attempts were 51% higher for adolescent girls and 4% higher for adolescent boys compared to the same time period in early 2019. Moreover, pandemic-related measures reduced in-person interactions among children, friends, social supports, professionals such as teachers, school counselors, pediatricians, and child welfare workers, which undoubtedly made it harder to recognize the signs of child abuse, mental health concerns, and other challenges in children. It certainly would be a tragedy to beat back one public health crisis only to allow another to grow in its place. Mental health challenges in children, adolescents, and young adults are real and they are widespread, but most importantly, they are treatable, Jennifer, and often preventable.
Stephanie, thank you for that additional insight. It is more than obvious that the youth of today are dealing with a significant amount of stress, and trying to identify ways to address that stress and identify resources has sometimes been a challenge for families as well as the individuals that are suffering. So I would like to turn to Michelle, who again is with the Sarah Michelle Peterson Foundation, a nonprofit organization dedicated to offering training and workshops to help people recognize and respond to the signs of suicide, which is preventable and also is the second leading cause of death among children, teens, and young adults. It's important to emphasize prevention in this context because it is such a critical piece of helping and supporting people who may be struggling. Michelle, the foundation and its work is personal for you. Can you tell us about the origins of the foundation and the purpose of its work and the resources and programs that you all offer?
Thank you. Thank you both for this opportunity to talk about personal story and the beginning of the foundation can help other people partly to see that anyone can be affected by mental health issues. Stephanie was talking about how the rise in young people that CHKD has been seeing over her time there. And I think that the community in general, folks in general, see that we actually we are all knowing many more people who are affected by mental health issues, and that regular kids from regular families, not just kids who live and behave in a certain way, can be affected. Our Sarah was a 9th grader at Morey High School in Norfolk, who was a Girl Scout, a lover of animals, participated on the track team and the cross country team at her school, was quite an accomplished runner. In fact, she was the 3rd of our 4 children in our family who were all teens at the time that she died in 2014 by suicide. At that time, our family and some good friends of ours decided to start educating people about suicide in youth. It just seemed like there wasn't a lot of suicide prevention awareness. People weren't talking about mental health in youth. As my other daughter, Ivy, said to us at the time that Sarah died, how can this even happen with a young person, that they can get to this point and can make this plan and execute it to end their life. And so at that time, we incorporated the nonprofit, and we started with just one program for youth and teachers and those who work with youth. So this was 9 years ago, and people just weren't talking about mental health quite so much. We quickly figured out that it doesn't make sense to educate young people about mental health without educating their adults. So the foundation began to grow. We added programs for adults. We added programs for professionals, in fact. And we began to include the well-known gatekeeper programs, Question, Persuade, Refer, commonly called QPR, and Safe Talk, and the faith-based program Soul Shop. And for youth, we use the full suite of Erica's Lighthouse programming. All of our youth and adult programs are evidence-based. They're designed to break down stigma and to provide knowledge, hope, confidence to help others. We've been doing a lot of programs throughout the community, including for providers who are seeing more suicidal ideation than they perhaps have in the past. You know, they're having more folks that need that type of assistance.
Thank you for sharing the story of your daughter, Sarah, and for creating a space where there can be more education as well as the conversation because we can't solve anything if we're not talking about it. So thank you so much for stepping up in that space, Michelle. So we've had the opportunity to talk about the trends and some of the challenges. And Stephanie, if we could switch back to you and start talking about the treatment options and support programs that you all provide at CHKD. So the Children's Pavilion opened in 2022. It's a 60-bed acute mental health inpatient hospital with 2 general psychiatric units, a psychiatric medical unit, and a neurodevelopment unit. This facility recently came online after you saw an 800% increase in mental health visits and consultations since 2015. So Stephanie, tell us about the Children's Pavilion and its role in meeting demands for services in your community.
Absolutely. When we started this mental health journey, I like to call it, it was 2013, and we were responding to several things that had occurred during that period of time, in addition to a community health needs assessment that we'd conducted with our community stakeholders to say, what is the #1 identified healthcare need that CHKD should be focusing on for children? And overwhelmingly identified the #1 need was access to children's mental health care. And at the time, we didn't have much related to children's mental health. We had assessment services, we had limited bedside services in the hospital for kids who had mental health conditions that needed support and care, and we didn't have much more. So the beauty of this program is that we started to develop in 2013, 2014, when we opened our very first, very small outpatient clinic. I was given the opportunity to take 6 of our LCSWs and get them trained on cognitive behavioral therapy, later on parent-child interaction therapy, and to start providing services to our community, outpatient services. And we really focused at that time on kids with both chronic medical conditions and mental health conditions. And we knew that we needed a lot more, and we were told that this is what we're going to do for now. And you know, then things changed because we saw such an increase in need, and our health system started to really open the door to looking at how can we better serve children with mental health needs within our community. And out of this, and a lot of research and a lot of very smart people in business strategy who really supported the development of our concepts, Children's Pavilion was born. So Children's Pavilion, as you mentioned, Jennifer, is a 60-bed acute mental health hospital. We opened our first 24 beds in October of 2022. We still have 24 beds open today. We hope to have our next 12 online next month. As people are well aware, workforce is a challenge. Virginia currently ranks 38th lowest in the country for the number of psychiatrists, psychologists, licensed social workers, counselors, therapists, and advanced practice nurses specializing in mental health care per population. And this is out of 2023 data in the state of mental health in America. We are also having significant challenges hiring psychiatric nurses, which is the largest of our workforce. Our challenge has been growing our workforce and assuring that our staff have the appropriate training and education to provide that high quality clinical mental health care. What's also important is that we have a development of a continuum of care to meet the needs of children across the spectrum. We do have 24-hour-a-day, 7-day-a-week coverage in our emergency department by licensed clinicians, master's level residents, supervisees, psychiatric mental health nurse practitioners, and psychiatry to support the growing demand for access and emergency mental health care. We have a consult team that works with our patients in our medical hospital that is comprised of psychiatry and psychology and social work and case management. We have an outpatient service that is located at 3 primary locations in our region, addressing the outpatient needs of our community. We're on target with that service for approximately 50,000 visits this fiscal year alone, and we are still struggling to keep pace with the demand. We are currently receiving about 175 referrals each week for children in need of care. We have an intensive outpatient program, which we opened last summer, that offers 12 hours of mental health support weekly for children ages 14 to 17. And that is open with 20 spots at this point. In January, we opened our partial hospitalization program with 10 spots. Hopefully we'll increase that to 20 soon to help complete our continuum of care. We have a bridge crisis clinic that serves children that are being discharged from our emergency department and are in need of an immediate appointment for care and intervention. Children generally move through this within a month or so and return to care as usual. We are the Eastern Region's partner for the Virginia Mental Health Access Program and provide psychiatry consultation to pediatricians throughout our region and case management 5 days a week. Within the last 2 years, we've partnered with 2 local schools and a 3rd school system to provide mental health support to students. We've created so much more access, and there are still children who are not getting to care. Early intervention is key to supporting our youth and changing the trajectory of their lives. Intervention early provides a foundation of skills that will carry an individual throughout their life and will most certainly reduce expenditures at the adult level. The cost of mental illness to our national economy is upwards of $500 billion to $2 to $5 trillion each year, depending on your data source and if you're looking at lost productivity and other factors. We certainly have a need for continued access to care and also looking at creative and innovative ways to be able to provide care to our young people in the areas with which they are, which is educational, school, after school programs, other things that our youth participate in. So we've moved the needle, and the needle still needs to move even further.
Stephanie, thank you for sharing that information and all the work that's being done at CHKD. To your point, it's unfortunate that the need has grown in the way that it has for our youth in the Commonwealth, but we are so grateful that the leadership at CHKD have stepped up in the way that you all have with the pavilion and are meeting that need and going beyond just the inpatient care and being reactive, but thinking about ways that we can prevent and get in the schools and address some of these issues earlier so that families don't have to struggle down the road. So thank you so much for that work. And I know you've been working extremely hard on this effort, and we are appreciative of that. So Michelle, a little while ago, you were sharing with us the work of the Sarah Michelle Peterson Foundation. And we know that the continuum of care and support services and resources is multifaceted and involves many providers, many stakeholders, and a ton of advocates. Can you tell us about the role of your organization in collaborating with treatment providers and kind of how that functions, as well as how you complement the work of a CHKD in your community and support individuals who are struggling or in crisis?
Yes. So when we have many people in the community who are able at the ground level, so to speak, to recognize youth suicide risk and warning signs, by talking to someone, by keeping them safe, by taking them or directing them to resources for treatment, we can actually make our communities safer from suicide. And this fits in with a public health approach to addressing mental health issues. So the Sarah Michelle Peterson Foundation can help by educating everybody about awareness and prevention. And in that way, we can allow those who do treatment to be freed up and use their time and their expertise to actually be doing that treatment. At our trainings and programs, we often connect with somebody who needs treatment for their child or for themselves. And since we're firmly in the prevention and awareness space, we need partners. We utilize our partnerships with our those who provide care. That's crucial for us to be able to direct people to care and support that they need. And I think that when they don't, again, when those providers don't have to spend their time and resources at the most basic level, when we're able to do that, it's almost like comparing it to CPR. You know, you can recognize that someone might be in trouble, do a few skills, and send them to the providers who can really help them. It's not a mistake that one of our programs are evident is the Gatekeeper evidence-based program, QPR, rhymes with it. Question, persuade, refer, directs people, you know, do a few skills at when you notice that someone's in trouble, and then you are directed to or referred to those who can provide treatment. I think that the partnership is so important because both sides need one another.
Absolutely. As they say, it takes a village. So before we close, I want to remind everyone that there are resources available for people who need behavioral health care. Hospitals like CHKD, the state, and organizations like the Sarah Michelle Peterson Foundation are all engaged in the work to help people access needed services. If you or someone you know is struggling with depression or some other mental health care or substance use treatment needs, please talk to someone or seek help. You can seek inpatient or outpatient care or just get started by calling the 988 Suicide and Crisis Lifeline, which is available 24 hours a day. I want to thank you both again for being with us today and the important work that you do. Thank you to Commissioner Nelson Smith and our audience for joining us. If you have any follow-up questions, please direct them to my colleague, Julian Walker at jtwalker@vhha.com. And please stay tuned for future announcements from VHHA about the next webinar in this series. Thank you so much. Be well.